Good morning, ma'am. I am Anhar Sawi from Davao Doctors College, your student nurse for today, and for today I will be performing Leopold'S maneuver. But first, let's define what it is. Now, Leopold'S maneuver is a 4 systematic steps or method of observation and palpations of the woman's abdomen. This is to determine the fetal lie, the position, presentation, and attitude, and determine the possible number of fetuses. And this is also to identify the point maximum of intensity of the fetal heart tone. In relation to the woman's abdomen, it is necessary because it will serve as an indicator whether the pregnancy will be delivered normally or whether the cesarean section is needed. Prior to performing the procedure, let us wash our hands. This is to deter the spread of microorganisms. Explaining the procedure to the client, you have to introduce yourself and identify the patient's identity using the 2 identifiers, the patient's first name and the last name. This is to establish rapport and ensure that you are doing the right procedure to the right client. And after that, explain the procedure to the client and this allow patient's cooperation. Good morning, ma'am. I am Anhar Sawi, your student nurse for today, and for today we will be performing the Leopold'S maneuver. But first, ma'am, can I ask for your first name and last name, and also your birthday? Thank you. Now, for today, again, I'll be performing Leopold'S maneuver, and Leopold'S maneuver helps us to determine the position of the fetus on your abdomen. And in order for me to perform that, I need to hold or touch your abdomen. Is it okay for me to do that, ma'am? Thank you. So, provide patient's privacy. This is to ensure the patient's comfort. If you are in a closed room, just close the door, and if not, just close the curtain and screen the patient. So since I am in a closed room, I'm just going to close the door. So let the patient empty her bladder first before the procedure, because a distended bladder may deviate the uterus, and this promotes comfort and allows more productive palpation, because the fetal contour will not be obscured by a distended bladder. Ma'am, if you may please go to the bathroom first to empty your bladder before we start our procedure. This way, ma'am. Position the patient in supine with one pillow under her head and with these slightly flexed. This is because proper positioning of patient facilitates accurate assessment and provide patient comfort. And with these slightly flexed, it relieves the tension of the abdominal musculature and exposing only the areas to be examined, maintains patient's privacy in putting a roll towel under the patient's right hip to prevent the supine hypotensive syndrome and shift away uterus from the large blood vessels. Now, ma'am, I'm going to position you a rolled towel. So let us assume that our client is in a dorsal recumbent position. If right-handed, stand at the woman's right facing the patient. Since I am left-handed, I will stand on the patient's left side. This is to easily grasp the symphysis pubis to be done in the third maneuver. Faces the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. The first maneuver, or the fundal grip, it is the palpation of the fundal area to determine what part of the fetus lie in the fundus. It could either be the fetal head or breech, and this is to determine the fetal presentation. Expose only the abdominal area and warm hands first before placing them over the patient's abdomen, because cold hands may stimulate the uterine contraction. And the important points to remember upon palpation: the head feels more firm, hard and round, freely movable and ballotable, while the breech feels softer and nodular.
So ma'am, hawakan ko po yung tiyan nyo. Excuse po.
Palpate on a downward direction on the sides of the abdomen, applying gently but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. It is the second maneuver, the umbilical grip, to identify the location of the fetal back and determine the position of the fetus in relation to the mother's left and right side. Take note to palpate in one hand steady on the other side, while the other hand is exploring the other side. And remember that the fetal back is smooth, hard, resistant surface, and long continuous structure will be felt, while knees and elbows of the fetus with a number of angular negulation.
Next, I'm going to place my hand on each side of the abdomen, while my left palm stays on her left side of the abdomen to steady the uterus, while the right palm palpates the right side of the abdomen in a circular motion from top to lower portion of the uterus. Apply gentle but deep pressure to palpate the fetal back in the small parts, and after that on the other side. Now on the other side.
Places one hand over the symphysis pubis and grabs the lower uterine segment between the thumb and fingers to feel the presenting part. This is the third maneuver, the Leopold'S grip, used to determine the presenting part and if the engagement has security. Using the thumb and the fingers of the right hand, grabs the lower portion of the abdomen above the symphysis pubis and press lightly and make gentle movements from side to side. For the findings, if the presenting part is still movable, it is not engaged. But if the presenting part is not movable, felt as relatively fixed and numb-like part, it is engaged. If it is firm, but must be the head. But if it's soft, it must be the breech. Turns and faces the woman's feet to confirm the findings of the third maneuver and determine the flexion of the vertex. This is the last maneuver, the pelvic grip, used to determine the degree of flexion of the fetal head and determine the attitude habitus. And for the last grip, I'm going to stand at the right side of the patient, but facing the patient's feet, and place it low on the lower part of the uterus. Then palpate it by pressing downward above 2 inches above the inguinal ligament, and palpate using the palm for the findings. Prominence on the same side, a small part, suggests that the head is flexed, and prominence on the same side as the back suggests that the head is extended. And remember that this last maneuver can only be done if the presentation is encephalic. Locates again for the back of the fetus and place the stethoscope over it and listen for the fetal heart tone. for 1 full minute. Note its location, rate, and character of the fetal heart tone. Since the fetal back is located at the right side of the abdomen, I'm going to place the stethoscope for accurate assessment, and I'm going to use the bell for accurate findings. And let's start the time for 1 full minute and check if the stethoscope is on. In cephalic presentation, fetal heart tone can be heard either on the left or right side of the lower quadrant of the abdomen. If breech, fetal heart tone can be heard above the level of the umbilicus on either left or right side. Based on the assessment, the fetal back is located on the right side of the mother's abdomen, and so is the fetal heart tone. And the recorded heart rate is 130 beats per minute and is strong and audible. Makes the patient comfortable. This is to ease and promote relaxation and explains the result of the assessment using language they can understand. So ma'am, we are now done for our assessments. Ma'am, tapos na po ang ating assessment. Ang presentation ho ng bata ay cephalic presentation. Ang ibig sabihin ho nun, normal ho ang magiging delivery nyo at unang lalabas po ang ulo. Meron pa po ba kayong mga tanong? Salamat po. Document the observation made, the fetal presentation, the position, and attitude, whether engaged or floating. Now, this is to promote the database for the future, and lastly, do hand washing. It is to deter the spread of microorganisms.